Hey, Dr. Smith.
Is it that time again?
It is that time again.
Is this
Everything's
on?
going. It is
Testing,
on. It is
testing. So what do we have today?
Excuse me. We have a cough for one thing. But
Everybody's been sick lately.
it's that time of year. It is that time of year. We had a question today from Maria. She said that she loves your videos, these 1 minute, the medical minute videos, but she said she's healthy right now, but she wants to make sure she doesn't have problems in the future. So what are some things she can do to help prevent getting back problems in the future?
Well, the number one thing is continue watching our videos. And she sounds like an extremely intelligent person. No. How do you prevent back pain? That's probably like the most common question I get. Number one, I think of using good body mechanics when you do things. When you lift, as your mother told you as a child, use your hips and your knees. And really what we mean by that is lifting should involve your legs, not your back, of course. You don't bend over and pick stuff up. And it's important to keep in mind that you don't really injure your back lifting the bag of cement. It's putting the bag of cement down. So discs are notoriously weak in twisting. So it's the twisting, especially twisted when you're sitting like this. So a common way, at least in the United States, to injure your back is be sitting at a desk, throw something in the garbage, miss, reach over to get it, twist your back, and then damage one of the discs in that twisting motion.
Really? Oh.
That's why I have a high garbage pail like this. Just kidding. Has nothing to do with it. It was probably on sale, to tell you the truth. So number one, good body mechanics. Number two, posture. Like when once again, your parents tell you as a child to always stand straight. Standing straight keeps your core muscles straight. If you do things, the spine's going to be loaded correctly. And then once again, if you're always standing hunched over, then that puts not only abnormal, basically it throws the entire spine out of alignment. So, and it can grow into that position, especially if you're young. And then posture when you're sitting, like I am. Number one, the human body is not designed for prolonged sitting or really designed for sitting. So when you're sitting, you want to get up frequently, stretch. A lot of times chairs, they will have lumbar supports in them. If not, you can get pillows like the McKinsey pillows that they have to put a little lumbar lordosis in your back. Which reminds me, when you're standing, you have a nice curve in your back. You notice how nice the curve is in my back? I see the way you look at me. But yet when you sit, it straightens out. And once again, it straightens out. All of the weight is on the disc so that the disc is then vulnerable under load to twisting. So sitting and twisting, that's why at least in the past, it used to be individuals that drove a truck, for example, were at higher risk for injuring their back. That and the vibrations too. Nowadays, they have so many air ride suspensions and stuff. I think that rate has dropped down quite a bit. And then the next thing I think of is smoking, bad habits. You don't want to smoke. Smoking has nicotine, and they think the nicotine constricts the blood vessels, which constricts the blood supply to cartilage and discs, and so you get premature aging. So like the vaping that's in the news and all the kids are vaping, like I'm not a kid, come on. It's really probably not healthy. Even though I know the way they talk about that, it's so safe. It may be safe as far as
Inhaling smoke.
Yeah, inhaling smoke, not getting cancer, stuff like that. But as far as other side effects, the side effects of nicotine, you still have those. And then I think of diet. And when I'm talking to my patients about diet, I usually talk about a good balanced diet. You want to, if you're female, especially young, you want to make sure you get calcium, you get vitamin D. because you want to avoid osteoporosis in the future, which is a common cause of back pain, both in men and women, but especially women as they age. And also under that category, I put diet as in don't get overweight. I know it's not politically correct, and in the office when I'm seeing patients, many times I won't bring up weight because you can't mention weight these days. Reminds me of, I had a family member come in the past, and they brought their studies with me, and I spent a long time kind of reviewing all the studies, the MRIs, and kind of going over it all. And just as she was leaving, she looked at me and she said, "You know, do you think my weight has something to do with it?" And I said, "Yeah, it probably does." Well, later that day, I heard her talking to other family members and stuff, and they were saying, "Well, hey, what did Dr. Smith tell you? You know, what's going on with your back?" And she looked at him and said, "He said I was fat." So all that time was wasted, you know. But diet, you want to get a good, well-balanced diet, and you want to maintain a nice, slim, athletic physique like the one you're looking at. And then the last thing is exercise. You know, you can't go to the doctor without having them tell you to exercise. Exercise in that you want to remember to do the stretching before you begin. You want to do not only the conditioning exercises, the cardiac exercises, but you also want to do core strengthening exercises. And there's, for those of you watching this on YouTube, of course, it's easy to Google and find lumbar exercises, but we could probably put a link to some at the bottom of this.
We have at least one exercise video on our channel too.
Oh, okay. That's true. We've done some exercise videos. So that's even better. If you look at Google, you'll find the exercises on our channel. So those are the main things. Good body mechanics, good posture, good sitting posture, avoid smoking and bad habits, good diet, as well as making sure you keep your weight as low as possible, a healthy weight, and then exercise. Exercise also helps you prevent osteoporosis for the future. It keeps the core muscle strong for when you do lifting, and those are the main things you can do. So hopefully that answered the question. But the best thing Maria, it was Maria, right?
Maria.
The best thing Maria is doing is watching this channel, because just watching this channel and following my advice, she'll stay young and never have back pain.
Absolutely.
So subscribe.
I have to put a little disclosure on that.
Yeah, none of that was true at the end. The beginning, yes. The end, no, that wasn't true.
It was a stretch, but...
Well, yeah, okay. You may not live forever. Okay?
That'll work. So, thank you, Dr. Smith.
Thank you. You're welcome. Bye.